Yeah, okay, great. Hi everyone, so my name is Mavra. I'm a postdoctoral fellow at University of Toronto and I'm part of the mHealth special interest group of the ISBNPA committee. So we have the International Society for Behavioural Nutrition and Physical Activity. And today we'll bring you a webinar. Just a quick few short housekeeping notes. So we have a bunch of special interest groups as part of SIG. And as mentioned, we are the mHealth Electronic and Mobile Health Committee. And if you would like to look at more webinars, they're also available online at the website of ISBNPA. So today, just to let you know, all the participants are muted. If you have any questions, please write them on the Q&A that is available to you as part of the Zoom. And we will answer all your questions at the end of the presentation. So we'll have our first presenter present as well as our second presenter, and we'll aim to answer them at the end. And you can also raise your hand using the features that's available on the webinar system. And lastly, just to let you know, this webinar will showcase recently developed and evaluate food detection applications and explore their implications for behavior change, considering we have a new generation of dietary tracking options that are available out there. So we're hoping to illustrate the novel evidence of food detection smartphone apps to explore the use of a food image recognition app on supporting nutrition behavioral changes, and to demonstrate the potential of technology in addressing these nutrition-related public health policies on a longer-term basis. So as mentioned, first we'll have Julie Tessier present. She is a registered dietitian and a PhD candidate at McGill University, and our second presenter will be Carol Boushey. So I'll go on to have Julie share her screen first, and then we'll start with Carol Boushey. Thanks. So I'm going to stop my screen. And Julie, it's all yours.
I'll unmute myself. Thank you, Mavra. So hello, everyone. As Mavra just briefly described, so essentially I'm a registered dietitian. I'm pursuing PhD studies at the School of Human Nutrition at McGill University. And I'm also the co-founder of Quinoa, which is an app that we developed for dietitians. So just to make it clear, this is not directly linked to, it's not part of my PhD studies. So I'm actually studying nutrition and aging. So this Quinoa is an organization, it's a tool we've created, and it's basically AI-based food diary for population and individual health, and I will be covering its development and its use mostly in clinical settings, private practice of dietitians, but also new applications in research. So of course we know that several adults are currently living with chronic diseases all around the world. And these numbers are fairly high. So if we just look at prevalences here in the US, so as high as 6 in 10 adults are living with at least one chronic disease, and 4 in 10 adults are living with at least 2 chronic diseases. So these diseases include heart disease, then cancer and diabetes, which are the leading causes of death and disability in the US. And of course, for those who are either living with a chronic disease or living with someone who has one of these, it decreases quality of life, it requires the use of medication, leads to disability, and has a high healthcare cost. So the good news is that the majority of these chronic conditions can be prevented. Major risk factors include poor nutrition, lack of physical activity, tobacco use, and excessive alcohol use. And I was particularly interested in knowing what's the weight attributed to each of these and how are they linked to chronic conditions. So I found this interesting figure. So what you're looking at is the burden of disease attributed to leading risk factors. So this is data from 2017 for countries with high socio-demographic index. So what you're seeing is that tobacco is actually the first the highest leading risk factor for burden disease. And within each bar, what you're seeing is the proportion attributed to different actual diseases. And the second one ranking here is dietary risks. Interestingly, we can see that the major proportion attributed is cardiovascular diseases. And then in second place, we see diabetes and chronic kidney diseases. And the last one, neoplasm. And another interesting observation we can make is that low physical activity is actually ranking down this table. And if we look at high fasting plasma glucose, high body mass index, high blood pressure, and many others, these are actually also related or can be modified via the diet. So there's clearly urgent need to identify solutions that should be targeting diet as an example, because it's a modifiable factor to prevent chronic diseases. So this leads me to the importance of dietary assessment to identify these solutions. At a population level, we can, with proper dietary assessment, we can identify dietary inadequacies. It helps us understand the role of nutrition in health and disease prevention. So at a public health level, and then we can assess the efficacy of nutritional intervention. And at an individual level, dietitians and healthcare professionals need dietary assessment on a daily basis, so for thorough assessment and monitoring, and to provide personalized intervention. And last but not least, patient empowerment can be done through dietary assessment. So if patients are able to actually know and understand a bit better what they are eating, it can actually empower them in monitoring their condition. Technology should definitely be leveraged in the context of nutrition, health, and research. I've listed a few reasons why it is important and how we can use it, but of course there are plenty of other ways and relevancy of technology in the field. So first of all, to track diet and collect high quality dietary intake data. And this is very critical because we know that dietary assessment has been highly criticized over the past years for its measurement error, though we know it's critical to assess dietary intake in such studies. But with technology, there's a high potential to address this measurement error. And then another point is to connect patients to their health professionals in real time. So if we follow this pyramid of going from population health to individual level. And lastly, to favor learning and behavior change. We know that it takes a lot of time for a person to actually integrate advice that they may receive from their health professional for it to become a behavior. And a nice approach to this with technology could be, for example, gamification, and actually encourage learning and behavior change in that sense. So the current dietary assessment methods include pen and paper and computer-based approach. So there's been this nice shift toward integrating technology for dietary assessment purposes. And these that I'm showing, because of course there are more and more different dietary assessment methods that has been developed, but these are the main used and cited in literature. And also going back to health professionals or dietitians, what they've been currently using up until now is mainly pen and paper, so 24-hour recalls or food diaries, but they have many limitations. So they are time consuming, either for the person who's administrating the questionnaire or for the person who needs to fill it out. So for example, a patient of a dietitian who needs to fill out a 3-day food diary. They rely on memory in the case of 24-hour recall, and then it requires subsequent analysis with a nutrition software that is also very usually costly. And of course, it requires a lot of time, again, to just enter this information in a nutrition software, and time is money. And then going through towards the computer-based approach, again, it remains time-consuming to fill out all of these questions online. There might be some challenges in terms of carrying the computer, so if the person's traveling, and there are many information that may be lacking that we could capture with other tools such as a mobile phone. So these are all informations that we collected and considered in the development of the mobile application Quinoa. So again, when it comes to technology or any tool that you would like to use to assess various aspects or factors, it's the balance between user-friendliness and accuracy and precision, which is very challenging to achieve. So if we think of the method that would be the most user-friendly, for example, it could be a method that's very passive. You don't require the user to answer many questions, for example, but then you're going to be lacking most likely accuracy and precision. And on the other hand, if you want to make sure you're capturing as much as information as possible by having a long questionnaire, the burden is going to be put on the patient or on the participant, which may affect compliance to the method you would like to use. And another consideration to keep in mind is how you're going to be maintaining this technology. And how are you going to make sure that this technology is going to remain relevant and in sync with the latest technology that evolves? So our solution for dietary assessment was Quinoa, which is a web platform that connects dietitians or researchers to an intelligent food diary for their patients or participants. So for the sake of this presentation, I will refer to dietitians and patients because the case study that I'll be presenting are from dietitians. And when you're looking at this picture at this moment, you really see, so this is in fact the flow that the app is following. So from left to right. So the client or the patient will be snapping pictures as they go throughout their day. So we have the picture, the food item they specify, and the quantity, and then in real time, the dietitian will receive all of this information within their web application and have access to many details. So if we look at this screenshot, you can see it move. I'll let this short video just run once, so that you can grasp as many information as you can and kind of familiarize yourself with the app, kind of understand what's going on. But this is what the mobile app looks like, and it's available on the Google Play and on the App Store. And so I'll just let it finish and I'll explain how that works. So this is me about to capture a pizza. So just before you're about to eat your meal, you just simply snap a picture of it. And then we have integrated artificial intelligence that will most likely identify the items from the picture. So this is to facilitate data entry. So once I've selected pizza, you enter, so you get within a builder. So you just select the options that apply to what you're about to eat. You select serving unit and quantity, and then you're done. So this is how the mobile app works. And currently we have over 11,000 users. So these users are mostly patients of dietitians who's been using the app because they're being monitored by their dietitians. So you must have many questions about how does the mobile app actually work behind the scene. So of course, this app is connected directly to food databases. So we're currently connected to the Canadian nutrient file and the USDA file. And it's very important for us to use validated food database. And the way we structured the mobile application, it's very easy for us to, for example, connect the app with the latest version of the food database so that we make sure we're up to date with the right, analysis of food items. We have a team of dietitians who have developed 370 recipe builders. And I like to specify the word builders because these are not fixed recipes. So if we go back to the pizza, the person doesn't simply select a type of pizza, but the person can actually select various specification within the actual recipe that applies to the meal that they consumed. So I was curious to learn more, especially because we have many users who's been using the app for a while now, I was curious to know how much time it takes to actually enter a meal. So I was able to run a few analyses on our side, and I found out that 50 seconds on average are required to enter a meal. And on average, people will also usually enter 5 meals per day, so per person. And overall, if we do a quick calculation, it's essentially a bit less than 5 minutes to complete an entire day, which is very quick. And we're continually monitoring this metric to improve the time it takes, while, you know, balancing again the accuracy and making sure that the data we're collecting is from validated databases. So now I'd like to touch on the artificial intelligence side, because I find it myself very fascinating. There are many challenges that arise with working with AI, and I believe that the largest one is really having a high number of data and having high quality data as well. So the way it works currently, we're able to identify food item from pictures, and we're also able to detect if current meal was previously consumed. So from this screenshot that you can see, this is a person who's eating basically the same breakfast every morning, so peanut butter and bread. And the small pictures that you're seeing just below the largest one are pictures that were taken in the past. So the more you're using the app, the better we're able to predict what you've consumed, and you can simply copy and paste the food items instead of entering it twice. So this also is a factor to reduce the time it takes and improve compliance of the person at actually, you know, reporting the information. How we're doing so? Basically, we are collecting many photos of meals, as I just mentioned, from our users. Every single information is de-identified. We're simply using pictures to train the algorithms. We know the associated consumed food items and the portion size that are reported, so that we can improve ourselves at being able to predict the outcome. So since the official launch in August 2018, we have reached 400,000 photos of meals. And basically these food items and portion sizes are ascertained by registered dietitians who go through these food diary with their patients. So we know that the quality, again, of the data that we're collecting is very high. Moving on to the features that were added to the Quinoa app. Starting with mindful and intuitive eating questions. This was an inquiry from dietitians that we received. So I know that we know that there are many different scales that can be used. So 7-point scale, 10-point scale to assess hunger and satiety. These are reported in various research. And dietitians are specifically using this 10-point hunger satiety scale because it permits them during their consult to bring the patient to think in terms of where they are along the scale. And an advice that they will provide to their patient is usually to just stick within the 3 to 6 points. So hungry and ready to eat, and satisfied, no longer hungry. And to avoid being at the extremes of famished and overstuffed. So the way we tackled this inquiry was to integrate it in the app, as you can see on these screenshots. So we've added a few questions around the eating behaviors. So why are you about to eat? Is it because you're bored, stressed, or tired? Then you have, what is your satiety level? The person can simply slide along the scale and select where they stand. And as you can see from the screenshot to your left, so these are questions that appear before eating the meal. And then to your right, you can see the questions that appear after the meal. So we have the repeated satiety level question, how was your meal? How do you feel? So a case study is really, usually dietitians will use these questions with patients who are consulting for weight management or disordered eating, for example, binge eating. It really helps the patients and the dietitian just understanding better the eating behaviors around what could be a trigger, for example, in the case of binge eating disorders. And then the way it works is that dietitians will be able to activate these questions on their end from the web application. So they will activate the question and maintain calories deactivated. So usually we will want to hide calories to prevent any potential obsessive behaviors. And when I talk about calories, this is the next feature that's added within the app. So nutrients can be activated on the dietitians or researchers side. So as you can see on this screenshot, you're seeing protein, iron, and carbohydrates that are activated. An interesting case study is with, for example, patients living with diabetes. And so in this case, in clinical settings, what dietitians are doing is activating carbohydrates and fibers to facilitate carb counting. So it's also helping the patient monitoring their own self, but also permitting dietitian to track this information. And in terms of research, so there is a research study who's actually using quinoa for monitoring of compliance to dietary intervention in the context of patients living with diabetes. And finally, this is what you're seeing on the web application. So on the researcher side or on the dietitian side, you have access to all of the pictures that your clients or patients, participants have consumed. You have the time at which it was consumed, food items, and then you have the breakdown of micro and macronutrients, as well as the time between meals. That's all reported. So when looking a bit more specifically, you can also see that it's easy for dietitians to communicate with their patients through the app, so they can add comments. And what has been reported is essentially it increases highly motivation of patients, just the fact that they receive encouragement through the app and that they know that their dietitian or healthcare professional is monitoring them kind of in real time. And it's also a way to kind of check in with the participant on the researcher side. And then more than 30 nutrients are available in the nutrient toolbox. You can also ask the participant to specify their sex or age, and you can compare easily to the RDA or UL. So for future directions, new technologies opens up new possibilities to answer research questions. So I'm not an expert in behavior, but I could think of a few questions that I listed here that popped into my mind also through the discussion that I have with dietitians. So does tracking of caloric intake actually leads to obsessive behaviors? As we know, many apps available to the general public include this information and show this to the user. Thus, prompting the user with questions related to emotions before and after the consumption of a meal improves mindfulness around meals. And I'm sure you have possibly many questions popping into your mind. And so we are very open to any collaboration with this tool. And so if you have any idea or would like to reach out, please do so. I'd like to finish by thanking our supporters that made this tool possible to be developed and that contributed to the actual success of the tool among dietitians and their patients who are being treated. And feel free to follow us on LinkedIn, Facebook, Instagram to stay updated in terms of the new features that are being added. And if you'd like to reach out for any collaboration, any inquiry, again, we're very open to this, so please contact me directly. Thank you very much also to the ISBNPA for the invitation to present this tool.
Great, thanks so much, Anjali. So we have few minutes, and if anyone has any questions, they can post it in Q&A. We did say we'll leave the questions to the end, but I have a quick one here, and I think we have time for one quick one. And Anjali, so we have a participant asking, is the app usable in Europe and elsewhere as well, given that it relies on North American databases?
Mm-hmm. So currently the app is available worldwide, so anyone can use it from anywhere. But of course, it's currently based on the CNF and USDA. So it would be a matter of just making sure that is these validated food database very similar to these other food databases from other countries. And there's always the possibility of just, you know, adding these food database to the tool.
Great, thanks. So if anyone has any follow-up questions to that or additional questions, we'll have them take them at the end. So now we'll move on to Dr. Carol Boushey. Dr. Carol Boushey is an associate research professor and the director of nutrition support shared resource at the University of Hawai'i Cancer Center. So take it away, all yours. Thanks. And I'll mute myself now.
Share screen. Can you hear me?
Yes.
Good. I'm in the process of sharing my screen. I didn't realize I had so many things open. Apologies about that. Thank you. I want to thank Dr. Ahmed and Short for thinking of this session and moderating it. And thank you to Anne Julie for going over the history and outlining an efficient approach for combining dietary assessment and behavioral messages. I'm going to focus on the technology-assisted dietary assessment, or TDA, which is an end-to-end system for capturing images of eating occasions, processing the images, and providing data to researchers for dietary data collection and structuring intervention messages, and compiling salient contextual information. The app is loaded to a study participant's mobile phone, either an iOS or Android, and we refer to the app as the mobile food record. Upon activating the app, there are two simple buttons. At the start of the eating occasion, the before eating button is used. So here's the view after opening the app. There, besides viewing the items to be eaten through the lens of the camera, the app displays red or green lines to guide the user to take an image at the best angle. The idea is to avoid an over-the-top picture, which would eliminate depth of field, which is needed to estimate volume. Once the before image is taken, the individual eats, and when finished, repeats the process by activating the after eating button. If everything looks okay, the user sends off the images through a secure cloud server to undertake image analysis to identify foods in the image. Once the foods have been identified, the picture is returned to the user's mobile phone for confirmation at the user's initiation. This image, by the way, is a stylized image so you can see everything clearly. This is not a real image taken by an individual. But you can easily see the labels identifying each food, which the user can touch the pin and confirm or select a different food label. This is an actual image. On the good side, the newer phones do look a lot better. They take better images now. In the example shown here, the user touched the pin labeled milk. Thus, the food search automatically brought up milk on the top space of the app. The task is to confirm the pin label or reject it. Note underneath are 4 suggested foods. Although these may not look similar to us, these are all foods which by color look like milk. The user would proceed to confirm, relabel, such as changing the saltines to lettuce, or remove the pins. For more specific choices, the user may want to select milk, and the default being 2% in this scenario, and change to another type. This actually goes quickly, the length of time per occasion being in seconds, very similar to what Anne Julie had just shared. Alternatively, there is also the choice to use barcodes. There are different interfaces depending on the study goals and participants. For example, in this one, the button that is added is the Ate It All for the after eating. This was a feature that was suggested by adolescent boys and young and middle-aged men who usually eat most of their food. In all these images, you have likely noted the checkerboard square. This allows for color correction. As you can see in this image, the same item looks very different due to the background and other issues. Color is the most important feature in food for identification, so we need to recalibrate the images to better reflect the correct color. We would not be able to estimate volume also without an anchor for size, so we can get size from the checkerboard square. Did people forget to put the checkerboard square into the image? See the big no, the line on this here, and it means no checkerboard square in the image. So that's about 2% of the images out of 4.5 thousand for this study. The oops is a different concept of forgetting to take the after image and needing to capture the oops to move the camera forward. Now that you've been introduced to all the parts and pieces, I want to share studies and their results. We have completed a comparison of estimated energy from known foods and beverages consumed and compared to doubly labeled water. This was completed over a week. The first meal was after the doubly labeled water dosing, and they continued for 7.4 days. And it's kind of fun. They look like a pretty happy group. The characteristics, there were no differences, although it was a small study, only 45 people. The mean percentage of underreporting was 12% for men and 10% for women. So not at 100%, however, definitely in line with other studies or better than other assessment methods. The next study is a 6-month trial among 247 young adults. They had 3 arms, 2 of which received an intervention, and across all 3 arms, diet was assessed using the mobile food record. For this study, the image analysis was completed by a dietitian. She received the images and then sat with the participant to clarify any food she couldn't recognize. You'll have to excuse me. This is a 6 months among 247. You can see this is the randomized trial outline. So for this study, the image analysis was completed by a dietitian. She reviewed the images, then sat with the participant to clarify any food she couldn't recognize. She verified image content, probed for forgotten foods, and then used the images to estimate fruits, vegetables, junk foods, sugar-sweetened beverages, and alcohol. This information was used to tailor the feedback messages. This just reminds us that one was a control group, and then there are 2 intervention groups were slightly different. The primary intervention received 2 personalized text messages addressing fruit and vegetables and junk food. In addition, they received weekly text messages. The other group only received the tailored messages. Multiple strategies included language, tone, and text messages, and communication style were applied for delivering the intervention. These are examples of the messages addressed to the user, all modeled after after the food assessment. "Hi, Alana," speaking to the person, and noted being from a member of the research team, saying, "It's Kate from chat." And all the amounts identified as servings of fruits and vegetables came from the TDA system, but the messages were catchy. So if you see the low fruit and vegetable statement, you can only go up from here. The same work was done for junk food, what's identified in Australia as junk food. In the end, the original objective was not achieved. The significant changes occurred only in the stylized dietary feedback, not the group that received stylized and then regular messages every week. The additional text added no benefit. The overall retention rate was 89%, was 89%. Before transitioning to the next study, at the bottom of this slide are the dimensions of the fiducial marker. When viewing slides, everyone thinks the fiducial marker is the size of a small house. This certainly is not the case and does amplify its purpose as correcting the sizes in the images. The next study represents a smaller pilot study addressing reduction in visceral adipose tissue, and the primary intervention was adopting a recommended diet. And note also the small attrition rate of 10% by the end of the study. Registered dietitians outlined the detailed instructions at time 0 and delivered the intervention messages using the motivational interviewing model. Initial instruction with the participants was provided in person, which included loading the app to the participant's mobile phone and reviewing the diet plan assignment per randomization. 8 intervention sessions conducted over the phone occurred across the 12 weeks. Images can provide other useful information, and because this is from the very study. For example, commuting, and what do we do while commuting when you don't drive? Time and date stamps are informative. The geocoding showed the participant to be in the middle of the highway, which confirmed that she was in a vehicle. And even eating on her return home. With regard to adherence of image capture, in this study, the prescribed days were 12 in total of dietary records from using the mobile phone. The means of 11.6 and 11.7 days out of this 12 that we asked for suggests high adherence. The information in the images really does help with personalizing the intervention dialogue. Another way of testing how well the mobile food record assessed adherence with regard to energy reduction, using the guidelines from the Systematic Evidence Review of Managing Overweight and Obesity, we estimated the expected energy deficit using data from the mobile food record. These results matched well with the actual weight loss, providing evidence of high adherence to dietary data collection using the mobile food record, and promising, a level of accuracy. Shifting now, this is an example of feedback shared with participants based on the 4-day mobile food record covering junk food, sugary drinks, and alcohol. If you notice the 2 separate meal items, these were actual images taken by a participant in this particular study. And those combined together exceed the individual's daily energy intake recommendation of 2,500 kilojoules. This particular study is wrapping up, so I actually don't have information on it yet to share other than this, some of the instructional items. This is another approach to summarizing dietary data into messages that, again, were informed by the mobile food record. The message to Jeff: your average daily serves of junk food was 5.5, although Jeff did do well in regarding sugary drinks and alcohol. So now that I've covered some applications of using the mobile food record, I want to share some accuracy estimations of food weights. The weights of foods in this sample that we use to keep training are known. The ideal ratio is 1. Between 2 time points, the latter using improved methods, some are the same or improved. And with the 2005, the French dressing and ketchup became worse. And as I transition, these methods actually that we used for these, are not using them anymore. And I'll share with you as we move on as to how things have evolved. We did better with this particular list. We have of foods, as you can see, because the goal being 1.0. As many of you know, approaches such as deep learning and convolutional neural networks, which were also implied by Anne Julie, have opened new and viable windows with regard to improving the identification of food and the volume estimation. In this graph, the green dashed line shows the ground truth, meaning the actual energy consumed. The points above this line are overestimated and the points below this line are underestimated. The mean energy ends up being off by 209 kilocalories, but again, it is widely skewed. However, this still allows for us to make salient messages with regard to making changes. Combining all of our work over the years, we have collected dietary data from children starting as young as 3 years old and have gone up to 72 years. The young children, we have determined they can capture their own images starting between 5 and 6 years old. Younger than that, they can't remember where they put down their mobile phone. We just finished working on with two investigators to assess dietary intakes of infants between 3 to 12 months old. This has been really a fun challenge. Of course, the opening interface needed to be completely changed to include foods, bottles, breastfeeding, and we have learned a lot and are starting study number 2. These are images from the Hawai'i infant pilot and a feasibility study in Australia. I am sure this is no news to anyone about the squeezable food pouches. These are a challenge. And if anyone has any ideas for us, let us know. We are this is absolutely common with regard to foods consumed by young children. I do want to emphasize we do not use self-monitoring techniques. Once the images are confirmed, the images disappear from the mobile food record. We do, though, incorporate the images later in some studies into messages, as I showed earlier. In summary, the image-based methods appear to be useful across the human lifespan. Active image capture methods have strong evidence of acceptability and usability. Adequate estimates of food and beverage intakes can be achieved for assessment and intervention message delivery. Continued research to further automate dietary assessment and link to appropriate intervention messages is recommended. I want to thank the many people leading the studies, helping and advising, and this is actually only a partial list, but there are a lot of hands that have been used to make all this work possible. And thank you. I'm going to stop my screen sharing.
Great. So thanks so much to both Anjali and Carol, and thanks again for being part of our webinar series. So we'll open it to Q&A right now. So if anyone has any questions, to please type them in the Q&A box down there. So I'll start off with one here for Anjali. So from what I understood, there's a choice of whether to display the nutrients to the patients after they have basically entered their information. Does that happen? So the information goes to the dietitian, and does that happen right away? And if it happens a little while later, how does that work?
So the way it works is for each of the patients or participants, the dietitian on their side, they can simply decide which nutrients they would like to activate within the mobile app. So they will always be available for that person as like throughout the day as they track their eating.
Oh, okay. And so are there any studies that are being done on how it may change their intake while they are consuming these products? Like maybe they consume less of it, or?
There are no studies regarding that specific questions of knowing how this could influence, and that's I mean, that's an interesting research question that could be that could be looked at. But currently, there are 4 studies that will be started, and there's one that's going to be published more related on the validity of the tool. But there's not much research done in terms of like behavior related questions.
Okay, thanks. So I have another question for Carol. Similarly, I think in terms of the long-term usage of messages that the participants do receive, do they sort of, get used to them over time and not look at the messages over time? Has that been shown?
Well, that's it, Mavra. That's a nice way to articulate that. Based on the chat study, we, and again, it's only one study, so it'd actually be nice if some other folks could replicate that. But what we took away from that is people like salient messages. So the messages that were salient seemed to make a difference. But all these messages every week, they were not tailored. But for some reason at the time, we thought that these weekly messages would be of value. So based on our work, we don't have evidence of that. And I would encourage people to try to further examine that. But I think the bottom line that we've been taking away is the message really needs to be tailored completely to the person based on, they probably say to themselves, well, gosh, the person knows what I'm eating. Why can't they address, things that I'm doing? And again, these are purely hypothetical on my part, but, have some backup with regard to the results of our studies. Because the one study that I showed, the second one, the pilot, those were all completely tailored messages, and the response was very positive.
Okay, great, thanks. So yeah, we'll be looking forward to some future studies with respect to that. I think that would be quite interesting. So we do have another question. I think it's for both Anjali and Carol from a attendee. Are there studies used in subjects with multi-morbidity?
With what was the word?
Subjects with multi-morbidity, so with multiple morbidity conditions.
Let me think. We have done some work with children with diabetes, and with diabetes and pre-diabetes. And unfortunately, those papers aren't done yet. But they have been, it's worked well. And it has been mostly children. When I say children, adolescents. And so, but other than that, I'm trying to think. We have children with disabilities. There's a paper published on that. But not with multiple comorbidities. That's a good challenge. Thank you for the idea.
Yeah, thanks. Anjali, would you comment on that?
So I could, well, I mean, in terms of the case study that I showed, so there is a current study going on to monitor and assess a dietary intervention. So in type 1 diabetes, but comorbidities. In fact, quinoa is a new tool, so we don't have much data yet on it. We don't have much research, and this is what we're aiming to do for the next years. And so the floor is yours if you'd like to study this using the tool, for sure. That's an interesting question.
Great, thanks. So in terms of, I think I do have another question. In terms of, we do talk about dietary intakes and dietary assessments and how our intakes may change, but at the same time, what's important and related is our food environment and how the food supply is changing in our environment. So I think I'm interested to know whether these tools, I think it's probably for both of you, can monitor or help us monitor that in some ways over in long term or over the years.
You know, that's a really good, that's being very on top of things. One of the, and Julie can also speak to this too. One of the most valuable pieces of information you get from these images is you actually really see what people eat. I refrained from showing quite a few pictures, but the one where I actually showed, you know, so you could see the size of the fiducial marker, that's the type of food that we're seeing the most of. Those are the type of eating occasions. And I think that it's really revealing when we actually open up these images and look at them and realize that people are not following our healthy guidelines. And so it would be wonderful to open up images and see and look at it and say, wow, this person is doing really well. We have seen some evolution that occurs at the end of an intervention, but I would like to be able to somehow structure together the intakes with regard to patterns as opposed to nutrients, and we ourselves have not done that yet.
If I may add, also, I totally agree with you, Carol, but with pictures also, you get to see the actual environment in which the person is eating, like the picture that you showed of the person eating in a car. So you get to learn a lot in terms of if this person eating in front of a computer, is this person distracted by other, you know, things around themselves. And so it's interesting to look at this. And also with the geolocalization, it's possible with a mobile application to know where this person is, what's the food access around this person. So it's easy to link all of these factors with the actual food consumption.
And we just need investigators to say, hey, I want to do this.
So many projects we could do.
That's really good news, actually. I know this field is just sort of, you know, gaining popularity, and it's been quite interesting. I myself, with Dr. Mary Love, have been working on a food flip app, smartphone app, and more the food supply and how that changes. So that was my main interest, and we've been trying to link it with dietary intake. So that's something we can follow up on with both of you. So I'll take one last quick question here. You know, considering the popularity that field is gaining, what would you say this field will look like in the next 5 years, you know, considering we have artificial intelligence and machine learning? So I'll open it to both of you to answer that. Thanks.
So what I could answer to this, I mean, in terms of those who are developing the actual technology, it's important to always keep this in mind. Where is technology going? Because otherwise you may spend several years just developing a tool that's going to be obsolete in a few years. So with quinoa, the AI and the algorithms we're developing using the database that's growing, it could be literally put on any picture or any video, any image of some sort. That could be collected. So I'm thinking if ever it's possible to capture, you know, images with glasses or anything, the algorithms that are being developed right now could be applied to any, you know, types of images that could be collected. there's this new iPhone coming, iPhone 12, that's also going to have AR, so augmented reality. That's going to be also interesting in terms of the distance. We're going to be able to measure and know the distance of the plate from the camera. So there are many things that we will simply be able to like add to and build on these models, so that we follow the evolution of technology. But if we could capture, dietary eating in a way that's the most passive as possible, that would be ideal, because it's less of a burden for the person to track their diet.
Yes. Yeah, it's an interesting question, and there are a number of projects going on right now that are aimed at trying to do completely passive data collection using glasses like what I have on, and applying something to the glasses. And so there's some issues, some privacy issues to deal with those methods, as well as, for example, it ends up that not everyone wants to wear glasses, and that's understandable too. But certainly with the advances that are being made, something will happen over time that will be fairly passive, will respect people's privacy, and everything's moving along that line. However, the one thing that is important, though, what has always been successful is using tools that people have. What are things that people use every day? That was why years ago we would get really good diet records, why we would get all these items, because everyone had a pen and pencil, and that was the only way we communicated, and we wrote and we wrote, we wrote. We are now past that with using computers. And so for those to really be able to upscale, it has to become the norm in this society. And that's, I think, something that we need to keep in mind as we go along with what we're doing now. And so taking images with your mobile phone, everyone does that. So us asking them to take images of their food is, okay, yeah, I do this all day long. So that's where we have to put this in context with regard to the evolution.
That's a great point, Carol. I really enjoyed the last bit about it becoming a norm. Yes, I think we will take this as our last point. But I'm sorry, actually, there's just one quick one. A student's asking, do you have any tips on the multidisciplinary work with IT engineers? She's a PhD student in Germany.
Carol, did you want to answer?
You have to learn the language. You take some time to read engineering papers and learn the language. There are a lot of words I use today that I never used 10 years ago, but I have, and at the same time, the engineers need to learn your language. And I'm lucky enough that the engineers that I've worked with, they all went through an introductory nutrition course voluntarily. And anyway, it's in time, we'll be able to bridge.
If I can add, so on my side, of course, we have, so the other co-founder of the Quinoa app is a software engineer. I couldn't start learning how to code. I mean, and then just hiring someone in tech to develop such tools is costly. It's very costly. So it's a matter of finding a way to be able to either have someone on your team who's working in the field and who knows how to actually create this tool. Because otherwise it's just either you hire someone external and you just pay them, but then the cost goes with it. So but I agree with you, Carol. I mean, it's we're experts in nutrition, and it's trying to find the right person who can be complementary to what we're doing.
But they're there.
Yeah, that's true. I agree with that too. So thank you very much. So it is 2 minutes above the hour. So what I'll do is, on behalf of ISBNPA as well as the mHealth Special Interest Group, thank you both to Anjali and Carol for being part of our webinar series. We really enjoyed your presentations. They're amazing, and we continue to look forward to future studies that come out. And thank you to all the attendees that have made for this their time to attend this webinar as well. So with that, Antonio, that would be it. I see you're back on in terms.
Yes. Just to say thank you. Thank you to everyone. Thank you so much.
Thank you so much.
Thank you very much.
Bye-bye.
Bye. Thanks, everyone. Bye.